Sunday night, inside a Kenyatta National Hospital theatre, a patient's head is opened to remove a blood clot. But hours into the surgery, the medical team discovers the clot they should remove is not there. Then it dawns on them that the man lying on the surgical table is in fact the wrong patient. The right patient was waiting for his turn at the casualty. Both men were reportedly unconscious when they were wheeled in.
The mix-up started at the point of dressing the patient, because the patient who was taken to theatre had the names, but those names belonged to the one who ought not have to have been wheeled to theatre.
A similar case of wrong patient being operated on happened about 5 years in Tanzania, where a patient was amputated. The wrong patient was amputated leg.
It's an incredible case of medical malpractice that has shocked the nation and shaken the medical fraternity.
Who did it? Why did they do it? What systems failed here? Who failed to do what? Those are the questions that are in every Kenyan mind. Because everybody is a potential patient.
I have directed the board through the chair that the CEO of this organization, with the colleague responsible for clinical matters of this hospital, are sent on compulsory leave forthwith, and in their place 2 experts will be taken over to run this institution for the period the investigations will be done.
The suspension of the CEO, whose tenure at the institution has been marred with several instances of bad publicity, was ordered on the same day of the deadline she had issued to former DICs to show cause why they should not be fired for their role in the mix-up. The 4, including the neurosurgery registrar, the ward nurse, theatre receiving nurse and the anaesthetist who were at work that fateful night, were suspended last week.
It was a good decision. I have come in so that I elevate the conversation and responsibility and accountability to the level of the leadership of this institution.
Brain surgery is one of the most delicate and complicated operations that would call for utmost attention to detail. A registrar training to be a neurosurgeon would be expected to be under close supervision of an accomplished neurosurgeon. The Daily Nation reports that on realizing the blunder, the operating doctor was instructed to stop the procedure, clean the area and close the skull when they consulted a senior neurosurgeon on call.
We would demand to know certain things, including at what point did the doctor interact with the patient? Who took the patient to the ward, to theatre? Who prepared the patient? What is your responsibility as a practitioner to a patient who is being wheeled in for operation? The level of interaction is key to us. Because if somebody missed something, then something should have been done at some point.
The 2 patients were shielded from the media, but the Cabinet Secretary confirms both are recuperating well, and the one who missed the surgery may not need to go under the cut after all. His peer, who got the surgery he didn't need, was to be treated for head trauma.
I have seen the patient. He is stable. The doctors tell me he could be discharged on Monday.
This is a terrifying medical error that should never occur. And while several incidents and allegations have been reported here over the recent past, the hospital says this is the most unexpected challenge to deal with. Sylvia Chebet, Citizen TV, Nairobi.